For treatment principles, we continue discussing tonifying upright qi and expelling the pathogenic factors. In interior patterns, the strategy of expelling pathogenic factors first and tonifying upright qi later is used whenever the symptoms caused by the pathogenic factors are severe so that they need to be dealt with. A very common example of such a situation is postviral fatigue syndrome. In this disease, there is always an underlying deficiency, but also usually dampness. It is a dampness that causes the tiredness, feeling of heaviness, digestive symptoms, and muscle ache. It is nearly always necessary to start the treatment by resolving dampness without tonifying the upright qi. This approach applies particularly if herbal treatment is given. Another example, patient with chronic kidney and heart-yang deficiency suffers an acute episode of total retention of urine leading to hypertension and edema. In this case, the pathogenic factor is water overflowing, causing edema and retention of urine. Since this needs to be dealt with without delay, one must first expel the pathogenic factor. In this case, water overflowing by using a reducing method on spleen 9, stomach 28, Ren 9, Ren 5, bladder 39, bladder 22, as the lower burner is in an excess condition. After the edema is resolved and the urinary function restored, one can tonify kidney and heart yang. Another example, a patient with a chronic condition of liver blood deficiency has an acute episode of liver wind causing temporary spasm of a cerebral blood vessel and a small stroke, with temporary giddiness, numbness, paralysis of mouth, and slurred speech. In this case, it is essential to eliminate pathogenic factor first, the liver wind, by using reducing method on liver 3. Only when liver wind has been extinguished and the symptoms of it are gone can we tonify liver blood. Strategy of expelling pathogenic factors before tonifying upright qi is not only applicable in acute and urgent cases, but also in chronic cases where the symptoms do not have a character of urgency, but are nevertheless distressing and painful. For example, a patient may suffer from a chronic deficiency of liver and kidney yin, leading to rising of liver yang. This would cause severe headaches, as well as dizziness, irritability. Although the symptoms are not acute or urgent, the headaches may nevertheless be extremely painful and distressing. It is therefore necessary to subdue liver yang first, and then tonify liver and kidney yin. In conclusion, in interior patterns, the strategy of expelling pathogenic factors first and tonifying the upright qi later is very widely used. In particular, we prefer to use this strategy in cases of dampness, phlegm, and blood stasis. So, expelling pathogenic factors first before tonifying upright qi is used when the clinical manifestations of pathogenic factors are pronounced and causing painful and/or distressing symptoms. It is a widely used strategy in interior and exterior conditions. Tonifying upright qi and expelling pathogenic factors simultaneously. This is a widely used approach in cases when there is a pathogenic factor and the upright qi is relatively weak, but not so weak as to need to be tonified first. This approach can be used only in interior conditions. As in exterior conditions, it is usually necessary to expel the pathogenic factor first and then tonify the upright qi. Thus, this strategy is used in cases of mixed deficiency, excess interior patterns. Many examples could be given. If there is a condition of liver yang deficiency with rising of liver yang, one can simultaneously tonify liver yin and subdue liver yang. In case of spleen qi deficiency leading to formation of dampness, one can tonify spleen qi and resolve dampness at the same time. From the acupuncture point of view, this involves using reinforcing method on some points and reducing method on others. In the two above examples, one could tonify kidney 3, spleen 6, liver 8 to nourish liver yin, and reduce liver 3 and GB43 to subdue liver yang. In case of spleen deficiency with dampness, one could tonify bladder 20 and stomach 36 to tonify spleen qi and reduce spleen 9 and spleen 6 to eliminate dampness. The strategy of tonifying upright qi and expelling pathogenic factors simultaneously is used when the upright qi is deficient and pathogenic factors are evident, but not so much as to require expelling before tonifying upright qi. Thank you for your attention.